Thank you, Ahmed. Good afternoon, everybody. So, like every every topics from this morning I have done, I began my discussion with what the French Committee for Ultrasound decided in 2005 about a screening. And as you see here in the second trimester, they have asked for biometry, and in biometry you just see there is just one image for femur. It's here, and also for third trimester. And as you know, we will speak a lot about femur because it is the entry to diagnosis osteochondrodysplasia. In first trimester, nothing about the femur length, but they ask, the French committee asked, that you have to see the 4 limbs, and in every limbs you have to see the 3 segments. So even if you don't measure the femur in the first trimester, you have to see it, or to see the 2 femurs in the first trimester. In the second trimester, it's a little bit more. They ask the femur length, and they ask also, there is 4 limbs, and in every limbs there is 3 segments. In third trimester, they just ask for femur length. We don't ask about the 3 segments of the limbs. This is for the first trimester. You see there is no limbs to see on the report. For second trimester, the femur, and also for the third trimester, the femur length. So the osteochondrodysplasia, we can do the diagnosis in first trimester. It's not easy, but when we do the diagnosis, it's a very poor prognosis. Why? Because there is low echoic femur. When you do a lot of first trimester scan, you can see that sometimes between 11 and 12 weeks, you cannot even measure the femur because it's so bad echoics that you cannot measure it. So for sure, it's very difficult to settle the cursor and to measure. But beyond the measuring, you can see if there is one absent leg. If there is, like you see here, deformation of the femur and the limb, and especially here you see what we call the champagne sign. It means a little thorax for a normal abdomen. It's like a champagne bottle sign. You can see here in first trimester a fracture in osteogenesis imperfecta in the first trimester, as you see also here. And we can also see here the heart is occupying all the thorax, and you see here there is 6 fingers, so for sure you are in an osteochondrodysplasia with a very poor diagnosis because there is no development of the pulmonary. You see here, I will show you this after, this is a Saldino-Noonan achondrogenesis type 2. You see really there is a problem on these limbs here, very, very short. You see here the limbs. In this observation, we are looking for this pathology because the mother have the first baby who have the same pathology, achondrogenesis of Saldino-Noonan, who is a recessive autosomic disease. You see here also a hygroma, as Azim showed you this morning. Also, it was an osteochondrodysplasia, an achondrogenesis in the first trimester. Now, in third trimester, before speaking about osteochondrodysplasia, I have to speak, because it is important in screening, how to measure the femur. Because before speaking about short femur, and as you know, the short femur have been an history for trisomy 21 and for achondroplasia, as you see here on the image, we have to be sure that the femur is short. We speak about short femur when the femur is less minus 2 standard deviation, or otherwise less than 2.5 percentile. It means that it's 2.5% of the fetuses. But before everything, we have to see if it is a short femur or not. So, because if, for example, you have a problem, I told you this morning about CRL. If the baby have inflection or in extension, it could change the beginning of pregnancy, And sometimes just looking on the first trimester scan and to see that there is a problem with the measurement of the CRL, the femur length, the short femur will become not a short femur. As you see here, we changed with 2 weeks, and here it is less than 2.5 percentile or less than -2 standard deviation, and here this is normal between the 10 and the 25 percentile. So sometimes you solve the problem just looking on the first trimester scan. But now, how to measure the femur? This, what I am showing you, is not the femur. This is the interface between the ultrasound that you are sending by your probe and the stopping ultrasound by the femur. The femur, in fact, is going from here to here, and from here to here, and from here to here. It's a rectangle. But what you see in white is just the interface between what you send as ultrasound and what is reflecting the ultrasound for your probe. So all these are the reflection of ultrasound. But you see the difference between this one, and that one is just the way how you send the ultrasound scan. If you measure, if you put your probe here, you will have this form of femur. If you put your probe here, you'll have that femur. And if you put your probe here, you'll have this femur. And the three is the same baby, just changing the way how you are sending your ultrasound. And between this one and that one, it could be the difference 2, 3, or 4 millimeters. It's mean more than 2 standard deviation. We are just speaking about the same baby. The same thing, you see here the difference between this femur and this one. It's just because this one is taking from the outside and this one is taking from the inside. So, how to measure it? The best way is to go outside and external and anterior. From the anterior and from the external, you will have the best femur. The external will show you this and that, and the anterior will show you not this, just that. Because if you measure from here to here, your femur is bigger because you are measuring a diagonal. So you have to measure from here to here. It's mean from here to here. So this one is 63 and this one is 67. It's the same femur, the same thing to measure. But what you have to measure is this. So you have always to turn your probe and to measure just the diaphysis. You don't have to measure the metaphysis or the epiphysis. And when you measure the diaphysis, you have to see the 2 epiphyses equal here and here. I know it's taking time, but this is something very important. Look between this one and that one, 45, 48. It changed a lot. This one, 61, this one, 66. This one is good, this one is bad. So if you're sending me this patient saying it's a short femur, perhaps there is an osteochondral dysplasia, and I just change the measure and measure this one 66 millimeters, I will tell you there is no osteochondral dysplasia, or ver madame à bientôt in French. So you see the equal is 7.5 percentile. It's a lot for a baby. So you have to measure from here to here. This is what we say anterior exterior approach. And so you see from here to here as I show you. Now this is good, excuse me. What certification of, now we are sure that it is a short femur. It could be an osteochondral dysplasia. It could be an IOGR, a vascular IOGR. It could be a trisomy 21. It could be a genetic disease. And also it could be a normal baby, but little constitutional state. It's a little baby because the father is little and the mother is little also. So the vascular, I will not do a lot. It's an IOGR. It's the femur going less and less. You have to do the Doppler. You have to see if there is hypertension, if there is oligohydramnios, if you have problem on the colon, and you have to measure everything. This is very easy. For trisomy 21, as you know, we have the combined test in first trimester, we have the NT and the buccal marker, and also you have other signs in the trisomy 21. Very quickly, you see all these signs. We push you to do a karyotype and to see if not a trisomy 21. Okay? Then it could be a genetic disease. Without osteochondral dysplasia, you have more than 484 entries. When you put in OMIM short stature, we have more than 484 genetic disease. So you just have to see other exploration, the family history, the face, as I showed you this morning, to do a 3D on the face to see if there is not a problem in the face. You have SLO, Smith-Lemli-Opitz syndrome, Fringe syndrome, charge association, as I showed you this morning. Now, you have decided that everything's okay. You are sure that it's not a family problem. It's not the father who is very little. It's not the mother, etc. So you have to speak about osteochondral dysplasia. You have several kinds of osteochondral dysplasia. You have rhizomelic. It means that it's taking the first part of the limb. The medium part, or mesomelic, or the severe osteochondral dysplasia, it means that it touches the first part and the medial part. First of all, you have in the first trimester, I'll show you, it's easy because it's very severe and it's easy to know. Then you have to see the constitution of the bone. In this situation, it's very easy. It is an osteogenesis imperfecta because, you know, when you push with your probe, there is the formation of the head, like you can see here, like you can see, and especially it's a broken leg, it's a broken femur, it's a broken femur. This diagnosis is easy. But in the same time, you have to do this diagnosis because if you don't do termination of pregnancy, this baby can have a treatment from the first second after delivery. We can give him now a new treatment. It will give him less pain for the baby because it will ameliorate the bone. You can also have very short stators as this one or that one, and usually it's a very poor diagnosis, and this sign is very important when you have a difference between the thorax and the abdomen. When you have a huge abdomen and a little thorax, even if you don't have the name of the pathology, you know that it will be a very poor diagnosis because the baby will not breathe after delivery. They have no pulmonary to breathe. Okay? Now, there is something, this one I showed you this morning, there's something very important, is achondroplasia. Why achondroplasia? First of all, because this is a disease without mental retardation. There is no problem on the after birth. He can breathe. And now we can see the sign very easily on ultrasound. Especially, you see here, this is the diaphyse, and this is the metaphyse. And this is the metaphyse. You cannot see it after for adult. For us, we don't have it. Just for baby. And you see the angle between the metaphyse and the diaphyse is 90 degrees. We know now that in achondroplasia, this angle is more than this, and it's open, is more than 90 degrees. It's 110 or 120, as I will show you. So, you see here, this is a baby with a very opening angle. You see how this is the metaphyse, and this is the diaphyse, and you see the angle, how it's open. This is a normal angle. You see the difference? When you see this, you have done your diagnosis. This is an achondroplasia. And it is very easy. Why? Because you have just to do a non-invasive test to the mother and to see the mutation of the achondroplasia on the blood of the mother. It will cost you 40 euros, $50, and you can do the diagnosis and especially stop searching other things. Now we can discuss about achondroplasia termination or not, this is not the problem. But you have your diagnosis. It's not a trisomy 21. It is not a vascular. It's not, etc., etc. It's not other gene disease. And the other, you see here the opening angle. You see here how the angle is open. Okay? You see here, the angle is open. And there is someone else also, something else, excuse me. You have, all this is opening. This is not the last one. I have another one at 27 weeks. We have also the spur sign. What's the spur sign? You see here, it's like the diaphysis is continuing to grow, and the metaphysis is not growing. So you have like a spur here, you see? Une épine. We say épine. We see this also in 3D radiology. You see here, this is the spur sign. And I swear to God, it's very easy to see. This is the spur sign. You see the metaphysis, the diaphysis. It's like the diaphysis is continuing to grow and the metaphysis is not growing. This one, look, I see this baby 24.5 weeks last year, 1 year ago, and you see even at 24 plus 5, you see how it's open, the angle is open, and especially the beginning of the spur sign. So now, this is all osteochondral dysplasia. I have just 4 minutes to finish. You have these 4 osteochondral dysplasia are not good for life because it's a very poor diagnosis, and all of this are good prognosis. It means that they can breathe and they can go after. All this achondrogenesis in the first trimester, they are very bad. You can do the diagnosis as this one in first trimester or in the beginning of third trimester. It's not very difficult to do this kind of diagnosis. You see the difference here. You see the thorax and the abdomen. This is the clubfoot. This is like achondrogenesis, but it's an hypochondrogenesis. It means that it's a chondrogenesis who you do the diagnosis in second or in third trimester. I will just show you some images of thanatophore osteochondral dysplasia, and just to show you how we can do the diagnosis. You do all the screening of your baby, everything, and you note it. And then, excuse me, I will go quickly, and you go, you will see here, oops, excuse me. You can, we have a kind of, voilà. Excuse me, I have, voilà. So you put all what you decided to see, and then you ask, excuse me, I will arrive. I'm doing the same thing, excuse me.
Still have 1 minute.
But still 1 minute, بس I will show you how, up this one. Okay. So this is my last slides. You decided if it is a short femur, very important, extreme, or less important. You see if there is calcification or not, if there is, it's mesomelic or mediomelic or all the limb, it is the beginning of pregnancy or late in pregnancy, how are the femur, if there deformation, and there is the bone, if they are broken or not. And every time you have this, we have built, if for example, if you take short femur with calcification, it will give you a chondrodysplasia punctata. It's X-linked syndrome. If you say, for example, micromelie with broken leg, it's an osteogenesis imperfecta. And if you want to see the vertebral are like this in 13. Every time you put this, for example, it's very extreme micromelia, it's an achondrogenesis. Okay, and you can see the spine are like this, there is apoechogenic. We return. If, for example, Very late micromelia, it have to be achondroplasia. If it is deformation, it means that it's dystrophic dysplasia, and you can see that there is a clubfoot. So you take all the information, it's very easy. You take all the information and you do this plus this, it will give this diagnosis. And it takes 2 minutes and you have the diagnosis. Thank you very much.
Thank you.